new sound. We just listened to Time Flies from Burna Boy and Sauti Sol. UNICEF is making it possible for us to have a very important conversation on the line. Good afternoon, Dr. Okello. How are you? Let's start with the fact that a lot of people, as we go into tomorrow's polls, are saying, but COVID is not really there. COVID is still here.
Good afternoon, Dr. Radio. Good to hear from you. COVID is not gone yet. COVID is here, and sometimes we misunderstand lack of looking for it to it's going away. What we are even reporting are cases that have been tested.
Yes.
And as you know, testing is not comprehensive. We are not testing everybody. We are not testing every symptomatic people.
Or contacts, everybody, yeah.
Or contacts. So when we say there are 10, it's because we have tested 10. But COVID is still here. COVID is not going away. It's getting worse, in my view.
Yes.
Hearing a lot more people are dying. Some are reported, many are not reported.
Yes.
If we have to count the number of people who have died since COVID started, we will realize that a lot of people have died in the period between March last year to now. A lot of people have died, more than ever before.
Wow.
And that is COVID.
So tomorrow is a big day, and of course a lot of people are going to be next to each other, around each other, operating, in same spaces. And when I wanted to find out about physical distance, I know a lot of people say, but I'm socially distancing. And then I'm like, maybe you're physically distancing. What's the difference, and what would it be? And then when we say physical distance, just how far apart should we be?
Well, my dear, elections have had a major problem for us. Perhaps it has been a super spreader, if I can put it.
Quick spreader, I'm telling you.
Quick spreader. We have ignored every plausible preventive measures during the campaigns, right from the primaries through to the actual election itself. People have disregarded the problem we are facing, and the methodology, the SOPs that have been prescribed by the Minister of Health have just been ignored. The physical distancing, the way we have prescribed in the SOPs, you must be at least 1 meter away. The wider the better. This infection is about what you're breathing out, the droplets that you're bringing out from your mouth. Those things fall away when the distance is wider. The air will just drop it down. But if you're very close, you're breathing somebody's breath. You're basically taking what they're pulling out into yourself.
Wow.
They're talking, when people are singing or talking, they breathe directly into their mouths what is coming out of other people's mouths. Even if they don't look sick, there are many asymptomatic people who are carrying the virus.
Yes.
That, we are not worried about. So for me, election, yes, let it come and go. But probably that is one of the biggest problems we've had at this time. For the virus to spread among ourselves. People are going to vote. They will line up. They'll be very close. I don't know how you could ask them to be at least 1 meter apart.
And there's those who believe, but I have my mask on, I can be close to you.
Well, unfortunately, masks are very, very important. I wish everybody could use masks. They really prevent those droplet infections I'm talking about. But, a lot of people don't put on masks. You live in Uganda, go to funeral places where, we're telling them put on masks. They don't. They just, in the villages, some people tell you they don't have money to buy masks. They have not distributed masks everywhere. So it's a problem. I totally agree with you. And unfortunately, the election should come and pass quickly.
Then we still figure it out after.
We figure it out, but I'm afraid it has not helped.
Help me, Doctor, clarify, because I have colleagues who got COVID-19, were isolated, were treated, and are much better. And they're back with working with all of us. But they have this thing of, but me, I can't be reinfected. In fact, all of you can get COVID except me. And I'm thinking that's not the right thing.
Well, I think there's a lot also we don't know about COVID.
Mm.
What people are banking on is the so-called immunity.
Immunity.
Yes, that when you get infected, you should acquire some kind of immunity that would protect you. But we don't know how long, if at all, you're protected, and how long you remain, non-infectious. But experience from elsewhere, people get COVID and re-get it again.
Yes.
After a short time. Or even they continue to shed the virus for a long time.
Wow.
So for me, the point we should emphasize is everybody, whether you were recovering from the virus, whether you haven't got the virus, we must maintain SOPs across the board. And this is the only way we can ensure that you don't infect others, or even you get
infected.
Get infected again. Yes.
Wow. So two things as we wrap. The first is I hear people say, but those are more at risk than others, and we must protect them. I thought all of us are at risk of COVID-19.
That's a very good question. Of course, all of us are at risk.
Yes.
But people with compromised immune system, these are people with chronic health conditions like TB, HIV. Their immune system is compromised. And also older people, naturally, their systems are slowing down. And that's why many of the deaths in Western countries, even here, it's about old people. So I think in terms of high risk, there are high risk people.
Wow.
And people, the people I've just described, or when you're in close proximity with patients, like health workers and so on, they would be at higher risk than ordinary people.
Wow.
But everybody is at risk.
Yes.
But these categories of people would probably succumb faster than anybody else. Even to ordinary flu, as you know.
Yes.
A simple flu we always had. You need to worry about pregnant women because immunity go down a little bit. You worry about people with immunocompromised states, all people. That kind of setup is ground for COVID.
Yeah. So lastly, I'm saying that I've been to a health facility a couple of times, of course, to test for COVID-19, and you find others there. And I don't know why my instincts are saying spray everyone, because this is where probably people who think they are sick are. But we can talk about health facilities, but also any other places you believe would be settings or places where you can easily contract COVID-19.
Health facilities are sick people, those who have confessed themselves to be sick.
Yes.
Unfortunately, you don't know what their sickness are. So when you go there, there are multiple problems. First, there is overcrowding. And wherever you have crowded people, you must be worried. But also because this is where people go to report their illnesses. So the probability of finding a sick person with COVID there is much higher than place. So you are right. You should be worried. If you are in a health facility, you should be on your guard. Make sure your masks are on. Do not touch surfaces anyhow, including where people are seated. Don't touch surfaces without worrying about your own personal hygiene. And don't touch the eye, mouth, the nose. While you are there, you should wash your hands very, very frequently and maintain your social distance.
Absolutely.
Put on your mask and so on. Yes, you should be worried when you visit.
Well, thank you so much, Dr. Okello, for your time. I guess mask up, that distance, regardless of how we are all going to be together tomorrow. It doesn't hurt to be cautious. Thank you for your time.
Capital FM, playing hits so big.